Welcome back. Well, all this week we are focusing on health. For many, a new year means new goals and sometimes new challenges too.
That's right. Our next guest focuses on orthopedic fitness and injury care. And we are here with Jake Bauwens, who is a physical therapist. Jordan Ruedt is a physical therapist, and both are here with the Orthopedic Hospital of Wisconsin. Sorry about that. Good to have you guys here.
Thanks for having us.
Great to see both of you.
Thanks for being here. What does fitness and orthopedic care look like as we're aging?
Yeah, well, good physical health does not necessarily have to look like one specific thing. It always is good to understand what works best for your body. But in general, overall, you should have a good balance between strength, flexibility, balance, cardiovascular endurance to be able to address all aspects of your body.
I think it's so top of mind right now with the new year and people having fitness goals and some people wanting to do something to be healthier and then being frustrated because they've got an injury that they're dealing with or chronic pain. So Dr. Bauwens, what kind of injuries do you think are the most common, the things that happen that you see the most often in your office?
Yeah, so I'm an orthopedic surgeon, and I specialize fellowship training in sports medicine and arthroscopic surgery, so I tend to see a lot of knee and shoulder injuries that come through the office. More particularly for the knee, I have a lot of experience treating ACL injuries, cartilage injuries, and meniscus injuries that may occur as people are trying to get in shape or even just their general athletic participation. And then for the shoulder, I see a lot of rotator cuff injuries and labral injuries. So, but I may see.
Yes.
Yeah, we both had that surgery.
It's a fun time, isn't it?
Yeah,
it really is.
Yeah.
So what kind of, when you think about getting these injuries, you're obviously going to see sometimes a surgeon, sometimes physical therapists. How can physical therapy help some of these common injuries that the doctor talked about?
Yeah, so we'll start off with a thorough evaluation, kind of looking at the source of the injury and understanding maybe possible deficits that come with that. And then we like to use a hands-on and exercise-based approach to kind of address flexibility, balance, strength, and everyday function in hopes to either reduce or eliminate those symptoms and then get you back to your prior level of function.
Mm-hmm. Yeah, so I always think about, if you need some type of surgery, you look for the after, like getting back into it. And I wonder too, if injuries don't get better, what are some of the options that people face? Because I think that's the thing is they want to get through it and get to the other side and get back to whatever they're used to doing.
Exactly. I mean, we rely very heavily on our physical therapists and other non-operative modalities like injections, anti-inflammatory medicines, or even activity modification for a period of time. If these things don't get you better, we may suggest that we get some advanced imaging like a CT, MRI, or ultrasound, which we have at our facility.
Oh, so you have it right there on site?
Right on site. And then surgery is most often our last option, right? But rest assured, if that ends up being the decision, most of our orthopedic experts are going to take you through all of the advanced surgical techniques and get you on your road to recovery as quickly as possible.
Do you feel like you often know, though, if somebody's really going to end up in surgery? Or do you feel like, let's try and avoid it, let's see if we can?
Yeah, I mean, we generally, get together and talk about our goals and what we want going forward. And if sometimes some things we say, yeah, that's probably going to be surgery to get better, but some things have the opportunity to try to resolve and get you back to where you are. So again, like she said, with therapy, it's not a one-step approach to each patient. Everyone may have a similar injury, but we have a different approach.
Yep.
You mentioned the imaging that you have right there on site. Are there other things aside from that you think make your place different than others that do orthopedic, take care of those types of injuries? Why people are happy that they chose you? Yeah,
so the Orthopedic Hospital has been around for a long time, and it's long been our mission to perfect the delivery of orthopedic medicine. And we do believe that hard work has paid off over the years as we are consistently ranked in the top 1% of patient satisfaction experience nationally year after year. At our facility, we do have all orthopedic surgery services covered, as well as physical therapy, pain medicine, and then our advanced diagnostic imaging. The other thing that we do, which you'll talk about on the website, is we offer the ability to be seen after an injury within 24 hours. And at that, you're actually seeing an orthopedic surgeon.
That's huge.
And we take tremendous pride in getting people back to their prior level of function.
What does the first appointment look like for someone? So say somebody's watching, they're like, yeah, I've had this issue for too long. I can't believe I'm still living with it. I got to have my knee or my shoulder or whatever looked at. What does that first base look like?
Well, typically we're talking about the injury or maybe what's been ailing you for the period of time and taking a good history and physical and doing a physical exam, and unfortunately sometimes making things hurt so we can figure out what's the issue. And we usually get some x-rays and decide whether or not, talk about goals and whether we're going to go a conservative route or straight to surgery if it's been something that's bothered you for a while. So taking everything in and making the best plan.
I felt like, and I know we talked about this a lot, both of us, when we had our shoulder issues, separate times, but going in and sometimes just getting that definitive answer of what's wrong, it is so empowering, because now you're like, yeah, that's why it wasn't working. That's why I was in pain. It's not me just sort of exaggerating this. It really is a problem. And I'm sure you really get to see a lot of patients on the back end or on the front end, and obviously see the big difference that you guys make as a team in people's lives. How does that feel?
I mean, I think I have the best job in the world. I don't ever wake up and say, oh man, I got to go to work, because I get to help people, right? I get them back to sports, I get them back to walking, all those things. And Jordan can attest, they do the same thing, just without doing surgery, right? But yeah, we're very happy being able to help people and get them back to where they want to be.
And that you're in
Good
the same
teamwork.
location together with that, because a PT is such an important part of recovery.
Can't
I think
recover
that's
without
huge.
it.
Yeah, thank you both so much for being here.
Thanks for
Really
having us.
Thank you for
Yeah.
having
Appreciate
us.
it,
We
you guys.
appreciate it.
You can visit the Orthopedic Hospital of Wisconsin online to make your appointment and see a specialist. You can get in the same day or the next day for most injuries and get better even faster. So just go online to OHOW.com and click on the button Request an Appointment.